public servant, effectively throughout of his life, ending up as Chief Fire Officer for Hereford and Worcestershire, and so for over a decade served the people of Hereford and Worcestershire in that role. He then became Deputy Chairman and Non-Executive Director of Worcestershire Acute, and then in 2021 became Chair of Hereford and Worcestershire Partnership Trust. Mark was an enormously helpful and supportive colleague, and our heart goes out to his family at his unexpected death. Mark, thank you for everything you did for all of us. Thank you for everything you did for our citizens, and we wish your family well. Therefore, we'll move on to the meeting itself. This is a live streamed meeting, so welcome to people who are joining us via live stream. We have invited members of the public to ask questions in advance, but if during the course of the meeting you'd like to ask a question, can I ask you to put it into the chat box? But at the end of the meeting, I will invite any members of the public that are with us to ask any question they would like of the Board of Directors. We're delighted to see so many members of staff as well joining us. We've got a few presentations for members of staff who are joining us throughout the evening, and at the end of it we'll be celebrating some particular votes of thanks to members of staff who have definitely gone the extra yard. So we'll move on then to the apologies. First of all, we have apologies from Nicola Twigg, who's one of our non-executive directors, and Joe Rouse. Gwenny, I don't think, who's also a non-executive director. Gwenny, I don't think we've had any other apologies, have we?
No, I don't believe so.
Okay, thank you. We'll move on then to the approval of the minutes held on the 26th of September 2024 for the last AGM. Board colleagues, if you're not happy to approve those minutes, could you please raise a digital hand for me, please? I can't see a digital hand raised, so I will accept that as formal confirmation of those minutes and will sign them in due course. So the first thing we're going to do in this meeting is to introduce the annual report for 24-25. And I'm delighted to introduce our Acting Chief Executive, Stephen Coleman. Stephen, over to you.
Yes, thanks. And it's not intimidating at all to do this with both Glenn and Jane there looking at me while I'm relatively new to this party. But I just wanted a couple of observations. If I move to the next slide, please. This one is one that gives a sense for people of the numbers that we've been seeing over the year. There's a couple of things that I just want to draw out. I think the first is that through the presentation, and you'll see it through a lot of the quality accounts and the numbers, we talk about things, we have technical terms for that and we have numbers. But I think the one thing that's really struck me when I've been in the trust, and I think we've got to hold really dear to us, is the numbers are people, whether that's colleagues or patients that we're seeing, and we've got to kind of, so while we get into a bit of speak about that, we never ever forget that these are people here, and that's what's behind our ambition and what we're trying to do. Since my time working closely with the trust and in the trust, one of the things that I think these numbers pull through, I think the phrase I would use is definitely punches above its weight in terms of the size of the organisation, but what it delivers to the community. And we've got some amazing colleagues who help us do that. The thing with the numbers are, there's some of these numbers that we really want to grow over the next year and we're really proud to grow, and there's others that we don't really want to grow and we want to see offer in a different way. So you could probably imagine those, certainly in terms of A&E attends now, inpatient emergency admissions, we've seen that grow. And when I get into some of the performance figures, you'll see the impact that that's had. But then equally, the trust has put so much work into, and again, with colleagues done some brilliant things around more of our elective and our cancer work, that you see those numbers start to grow and change. And that will be something that we'll follow, and we'll create more of a narrative as we go through, in particularly as we see the 10-year plan come together. So go to the next slide, thanks. So in terms of our performance metrics, what you see here is generally the trust has done really, really well, and particular ones to pull out are those around some of the cancer standards that we've got. Some of the things that we class it as productivity, so the cost of the service versus the amount we've done, there's been a real shift in the trust, and we'll get into the detail of what's driven that, but that's been really good. And one I want to draw out is the elective performance recovery. So again, for members of the public, it's a bit of a funny term, but actually what that means is we saw many more patients, and we got through, and we are starting to really get through that waiting list and that backlog that was particularly built up after the pandemic. So there's some really, really good signs, and it's a real fruit of the hard work that everybody's doing around that. The emergency 4-hour, we are about to head into a winter period, and I think what we would say for the year that we're covering here, it was a particularly difficult winter. It was particularly difficult because of the flu season that we saw. So it came early, it came hard, and it lasted for a while, and it was then compounded by other infections. So it would be remiss of me not to promote anybody who is due a flu or a vaccination. Please get one, so that we can see better performance through there, because we don't see as many people coming into our hospital and into our community services as we did last year. Move on to the next slide. So the trust sets itself some objectives, and this gives a sense, and again what you see with the green colours is the amount that it was able to do. And I've kind of, as I've looked at them, I've pulled them out into kind of two big themes, really. There's a theme of sustainability, and that's, in some senses, sustainability as we would traditionally think about the environment, but there's a real sustainability around our people and our colleagues in terms of growing our own staff, being able to drive forward the number of patients that we need to see in our elective and cancer services. And my other big theme that comes through all of this that I think the team are really proud of is around innovation. So you see things in there about education and about research, and there's some real work that's gone in there, and we're starting to see that bear fruit as well. And you'll see some of that through the annual general meeting. I think there's one of the poster presentations that was done is just the sense of innovation that's in the trust, and the work that people are doing is really, really something to be proud of. So we'll go to the next slide. So we started to pull out some of the highlights, and again, it just kind of, I think when you do this, colleagues need to kind of take stock of this, because we're in the day-to-day and we're looking at it, and actually when you step back and you look at the infrastructure that we put into the trust and what that is now delivering, it is significantly impressive. So the bits that I just wanted to pull out, we talk about productivity. So again, how many more patients we are able to see in a way with the workforce that we've got, the work around the missed appointments there and the reduction that we've seen in that. So again, that's a real combined effort with our clinical staff and our admin staff pulling that together. The cancer work I've touched on, but the really exciting bits of what is now coming through our surgical hub and what we will be able to achieve with our community diagnostic centre. So again, they are big steps forward for place and for what we can do with partners, but not to underestimate, just as a slide on there, the amount of work that's gone into that from colleagues. So we'll go to the next slide, thanks. And I just want to pull out a couple of these bits, and again, they are themes that run through. So one of the things that we've been working really hard on in the year and started to see some real progress, and I think we'll be able to report even more progress back, is what we call fragile services. So that's where there may be a small workforce, there may be a big demand to the service that we've got, and it's working through that to deliver a sustainable service which is better for the population. And one of the things we mean is, one, we can see patients quicker, but it also means that you won't be going somewhere else because we can't provide that service here. And we're really starting to see some progress on that. One of the things that Jane, as the Managing Director, has personally driven forward really, really hard, and again, as a sense of innovation in the trust that you might not think if you were looking in, was around artificial intelligence. It's relatively new, isn't it, for the health service, and we're thinking that through, but Particularly, I think what's impressive here is how it's been a ground up. This is colleagues who are going away trying things, sharing it with each other, and we're now starting to see the real kind of fruits of that coming through, in particularly around how we are taking some of that administrative burden off our clinical staff so that we'll see more patients again. It's easy for that, and we'll see the benefits of that. The other bit that I think comes out of it and sometimes gets lost is the improved patient experience that can give. So particularly when you look at outpatient areas, our patients are saying, and I've spoke to a number of them in the trust, it's really different not having a clinician staring at a computer screen trying to tap when they're doing an appointment with you. They're actually looking at you and engaging with you because it's working away in the background. So I think sometimes we lose that bit, but I have spoken to a number of patients who report that back. I think there's some really good work that's continued for years, again, around the people promise and the way that the trust has done the staff survey. We're working really hard. It's out now. So again, as well as vaccination, a plug for if any colleagues are watching it, please fill in your staff survey. It's really, really important to us that we get that feedback on what we're doing well, but also where we need to improve. And we're never complacent with anything like that. And I think the higher the response rate gets, it's a really good indicator of how engaged people are with the organisation. So again, just to pull out some of those where people feel like they can work flexibly, they work as a team, and they're recognised and rewarded. And kind of alongside that, one of the things that I think the trust should be rightly proud of in the year is that growing our own staff and colleagues. So particularly the impact we can have in Herefordshire as a community in terms of employment chances and what we offer there is significant. And actually it's a circle, because we know that if people have good employment with good careers and can go forward in that way, they actually lead healthier lifestyles. Most of our staff actually live in the area, so we don't underestimate the impact we can have on the local community. And it's more than just the hospitals or the services or the trust that we provide. We really take that seriously. Next slide, thanks. The other thing I should point out, it's brilliant that we've got so many slides that are highlights of the year, isn't it? That you just look at the amount of volume of work that we've been going on. So another really, really important element that will take us forward with the 10-year plan is the work that we've got with our community services and our partners. And there's a real strength here in Herefordshire about how everybody is working together to deliver that. And I think one of the things for next year that we will report back on, and the year after that, is around the opportunity that we've been given to take part in the National Neighbourhood Implementation Programme. So that is a real thing for all of us as partners together to come to work as one of few organisations in the country to really look at care for particularly older adults, be leading that, and then for other systems will then be learning from us. And that really is a recognition of the work that has gone on before. So I think we were really pleased, but I think it was also a recognition of the really hard work that's been done over the years, and then particularly in terms of our community services that I know deliver absolutely phenomenal services and have a real impact to our population. Next slide, thanks. So this is just a look forward. Well, we're kind of halfway through this year. It's always slightly odd, isn't it, when you do the AGMs that you're doing a look back and you're halfway in the year that you've been living for 6 months. So this is just to give people a sense of what we've set as the objectives for this year that we are really well on in terms of delivering. And I think we'll be able to report back again when we do the next AGM on that. And I think we'll be suitably proud of this year as well, because it's really just been building on. So they're my comments, Chair. Happy to move on.
No, thank you very much, Stephen. And hopefully members of the public will see there's much to be proud of, despite the challenges of the increased volume, particularly around, for example, 23% increase in A&E attendances. But we recognise as a team, whilst there's much for us to highlight and celebrate, we do not always get everything right. If you are one of the people who've been waiting in an A&E for a number of hours, we apologise, but the teams are doing their best. If you've had a bad experience at the hospital, we apologise, but again, the teams are genuinely doing their best. And we recognise we don't get everything right, but hopefully from what Stephen's described and the other presentations that we'll move on to in a moment, you'll get a sense that the Wye Valley Trust team and your NHS is improving year by year. And as Stephen mentioned, on Monday, the new Community Diagnostic Centre will be open, which will be a real benefit to everyone in Herefordshire. So one of the things we want to talk about is the work that's been going on in terms of theatre productivity. So I just want to hand over now to Jennifer, our General Manager of Theatres and Anaesthetics. Jennifer, over to you.
Thank you so much, Chair. Next slide, please. So I'm really pleased to have the chance to talk about the fantastic progress we've made in our hospital theatres over the past year. To put it simply, back in April 2024, our theatres were being used about 77% of the time that they were available for operations. By August 2025, we managed to increase that to nearly 84% against the nationally expected target, which is 85%. When we talk about utilisation, we mean how much of our available theatre time is actually spent carrying out operations. This improvement has made a real difference for our patients and staff. By making better use of our theatres, we're able to treat more patients and get them seen more quickly. This means shorter waiting times and less anxiety for people who are waiting for surgery. Our teams have also worked really hard to make sure sessions start on time, cutting delays at the beginning of the day from over half an hour to just 12 minutes. This puts us among the top performing hospitals in the country for theatre efficiency. All of these changes mean our patients are having a better experience from the moment they are scheduled for surgery right through to recovery. Over the past year, we've also been able to increase the number of operations per theatre session, making the most of every opportunity to treat more patients within our allocated resources and to drive down waiting lists further. Next slide, please. Thank you. I'd like to also take a moment to highlight the fantastic progress within our elective surgical hub. So since opening in July 2024, we have seen a strong increase in planned operations, with activity up by 80%. This isn't just about numbers, it shows we are reaching more people who need care and making a real difference to our patients. We've also made some great progress in helping patients recover more quickly. More people are able to go home on the same day as the procedure, and in August we saw some important milestones such as patients having hysterectomies and being able to return home that same day, in addition to much shorter stays for hip and knee replacements. The times patients remain in hospital following joint surgery has reduced by over 1 day on average. These are really important steps forward in our patients' care. One of the biggest improvements has also been in reducing how long our patients need to stay in hospital. Our average length of stay has come down significantly, which means our patients spend less time away from home. Over the past year, the elective surgical hub has supported a really large number of patients, and everyone involved should feel really proud of what we've achieved together. Next slide, please. Thank you. Now, as we look towards the next 12 months and beyond, our aims are clear. We want to keep building on our progress and make an even bigger difference to our patients. One of our main priorities will be to keep improving our theatre schedules. We will continue to work closely with our teams to make sure our theatre sessions are productive, offer value for money, and that we are making the best use of every single slot. We are also preparing to introduce the Federated Data Platform. This is a new system that will give us better and faster information to help us plan and make decisions. It will really change the way we manage our elective care. Another important step is working towards the accreditation of our elective surgical hub. So it's a formal recognition of the quality and consistency we have achieved. It will help us to measure ourselves against national standards and also find new ways to improve. And finally, we will be bringing in My Pre-Op Plus. This is a digital platform for preoperative assessments. It will make the patient journey smoother, reduce delays, and it will improve safety while also freeing up valuable clinical time. These are not just small changes, I'm sure you will agree. They're part of a much bigger plan to help us treat more patients more efficiently and with even better continued results. None of this progress would have been possible or will be possible in the future without the ongoing dedication and support of all of our incredible teams and staff within the surgical division. Every single patient, every single person continues to be the best to achieve the best outcomes for our patients. It's so important to recognise, and I thank everyone for the continued hard work, commitment and drive to make a real difference. Thank you.
No, thank you, Jennifer. These things don't happen by accident, and your leadership in this regard, and Jonathan's and others on the surgical side, really greatly appreciated. You're doing a super job, and still an awful lot more to go after, as you've indicated. We're also, one of the other aspects which we're really proud of, and actually for the last 10-15 years Herefordshire has been at the forefront of, has been delivering more care in the community. So I'd like to hand over now to Sarah Cinder, our Associate Chief Operating Officer, to brief us on that. Sarah, over to you.
Many thanks, Chair, and thanks for the opportunity to come and share our work with you. Next slide, please. Okay, so this is all about enhancing the services that we provide to our patients in their own homes. So this is a real celebration of what we can do in the community. And as Stephen described earlier, that shift from hospital to community and the neighbourhood health plan, and we're in a really good position to be able to deliver that. So in the past 12 months, we've seen our services enhance. And since October 24, we've had a dedicated doctor, and that's a GP, who works 12 hours a day, 7 days a week, 365 days a year, in our single point of access, which we call our community referral hub. So this GP supports our therapists and our nurses, and they work as a multidisciplinary team to try and keep patients at home, so to avoid bringing patients into hospital when they don't need it. And we just feel that in terms of patient outcomes, it gives a much better service for our patients. So the doctor coming into post has been a real benefit for us. We've also strengthened our work with West Midlands Ambulance Service. For us to be able to achieve what we need to achieve, we need people to make referrals to us. And West Midlands Ambulance are a really key partner for us in terms of being able to give us the opportunity to keep people at home. It has to be said, for those patients that absolutely need to come into hospital, that is still what we do. But there are so many opportunities for us to keep our patients at home. So the work we've been doing with West Midlands Ambulance has really made a difference, and I'll show you some data in a minute on a separate slide in terms of what that looks like. But interestingly, in this very digital age, the paramedics said to us, we could do with a card to go in our pockets that we can pull out and check. And that's made the biggest difference. So a simple card telling them about what our services can provide has meant that not only they refer our patients to us, but that they trust us. So that's been a real success for us. And in the last 24-25, we have really enhanced our virtual ward offer. So these are ward beds, but they're ward beds in people's own homes. They're supported by a ward team. So we've got a ward sister, we've got ward therapists, we've got nurses, we've got a pharmacist, and they all provide that support to patients in their own homes. And it's for those patients that we think actually they could do with a little bit more time. They could maybe do with a week's worth of support. We need to closely monitor them. They're a bit more complex. So we admit them onto our virtual ward and care for them in that way. And it's our fabulous community services teams that provide that care to them. Next slide, please. So this is just a bit of data. So the table on the left, we get about 800 referrals a month through our single point of access, which is a really good number. And of those 800, we class them as 2 hour, needing a 2 hour response. So we need to provide an urgent response to these people. You know, we can't leave them. So the graph on the left is in the blue blocks is the number of referrals that we've had for patients requiring a 2 hour response. So as you can see, that's growing and rising, and we're getting much more in the way of demand. And then the red line across the top is how quickly did we get there? So we are set a target of achieving at least 70% response to those patients within 2 hours. And you can see on that graph there, a couple of slight dips under the 70, but we're consistently delivering 80 to 90% of a response time. So it really feels like we've got that right now. The graph on the right is what I was describing earlier in terms of those referrals that we get from our ambulance service. So it's either paramedics that have gone out to the patient's home and said, actually, there's an opportunity here for us not to take this patient into hospital. We could probably, if we get some help, we could keep this patient at home. And you can just see there in terms of those numbers. So, you know, April 24, we were getting about 75 referrals from our colleagues in West Midlands Ambulance. And then by March 25, we were almost at 300, and it's been consistently around about the 300 mark since then. That's really important because it gives us that chance to be able to make sure that patients aren't being taken into hospital when they don't need it. Next slide, please. So this is just around where we feel like we're avoiding those admissions. So we're avoiding more patients being in A&E, more patients occupying our hospital beds when they don't need it. The red element is where we can't. You know, there are some patients that are referred to us and we go out and do our visit and we say, actually, we're not going to be able to manage this person at home. We are going to need to send them into hospital. And that's the right thing to do. That's not a fail. But you can see from the graph there that, again, those numbers are rising and we're able to keep people out of hospital and avoid their admission. Next slide, please. So this is what we're doing. We don't stop, and we've already started a lot of this work. So just wanted to let you know really what we've got planned. So we're looking at particularly supporting patients via the 111 pathway. So when a patient rings 111, they are generally directed to our emergency department. And what we've identified is that actually not all of those patients need to go to our emergency department. So we're now about to start a project where a number of those referrals from 111 will actually be sent to our single point of access, because we've got a GP, we've got a nurse, we've got a therapist, in an attempt to keep those people away from hospital when they don't need to go there. So that's really exciting. The other element that we're working on at the moment, and it's linked to the community diagnostic centre that Stephen described earlier, is we'll be able to access that from our urgent community response teams. So where we recognise that some of our patients might need a scan or they might need an X-ray, it'll be an easy pathway really to be able to get them up to our new community diagnostic centre. And also we're hoping we'll be able to also book our patients in to our same day emergency care units at the acute hospital, whether it's a surgical patient, a medical patient, a frailty patient, so that they can have that quick consultant-led and therapy-led assessment, and then we can get them back to be able to really look after them at home. We're doing an awful lot around communication and engagement just to make sure that everybody knows that we're here, because we absolutely want our demand to grow. We don't want it to slow off. We don't want it to reduce. We want ours to grow. So there's an awful lot more we can do in terms of communication and engagement. And that's about it for me. Thank you, Chair.
So a few slides describing a monumental amount of work. And this is really very much part of the 10-year plan for the NHS, making more and more healthcare be delivered in the community, and our neighbourhood service really is fantastic. And I think particularly for our frail elderly and their families who are trying to look after them, the more healthcare we can deliver in the home, the better it is for them. That's a very anxious-filled experience if you're frail and maybe a little bit confused coming into a hospital at the best of times. So really super work, and as you say, it's future-proofing our services but also delivering a better experience for our citizens. Sarah, thank you very much. After those sort of two what I describe as exciting and innovative examples of the work going on, Katie, bless her, has to tell us about the numbers and the annual accounts for last year. So Katie, how are the numbers, or how were the numbers?
Thank you, Chair. So next slide. Thank you. And actually, of course, the numbers are the output of everything that we've just talked about and described in terms of the activity we've delivered and those improvements. It all plays through into these numbers. So it's not as dull as you might think it is. In terms of the finances then in 24-25, I just want to give a quick overview really of some of our key metrics from a financial perspective, and a little bit around our annual accounts process. It's fair to say 24-25 was a challenging year. We set ourselves an ambitious financial target at the start of the year, and we achieved an adjusted financial performance, so a deficit of £5.6 million. That was slightly adverse to the planned deficit, but was in line with where we'd ultimately forecast to land as part of the overall system position. During the year, we did experience some unplanned pressures from a financial perspective, largely linked to some of our operational pressures and some workforce challenges, for example, sickness. And we partly mitigated those, and that's evident in the outturn, but weren't able to fully mitigate them. We've got in last year, we established a financial recovery board. So the start of the financial year last year was demonstrating to us some of that challenge in the overall delivery. So we established a financial recovery board, and that's really helped us with strong oversight of some of those risks and mitigation, and allowed us to drive some of that in support of delivery of the outturn. We delivered a significant cost improvement and efficiency programme, so just over £14 million worth of efficiencies was delivered during the year, and our agency spend is reducing year on year. So we've really started to make inroads in the year just gone into reducing the amount of money we spend on temporary workforce, which is not only a financial drain to us, but often can give us a lower standard of quality than we might expect from our substantive workforce. I think it's important to note as well, what we really saw last year is that continued strengthening of that culture of financial ownership within the organisation and throughout the division. So a really big thank you to everyone in our teams that have supported that focus on the money alongside all of their other priorities. From a capital and cash perspective, we, despite some of those challenges in our position, managed to maintain our better payment practice code performance. So that's about paying our suppliers within 30 days of their invoice, and really supporting some of our small local businesses to make sure their cash flow is maintained. And we spent around £26 million on capital projects, which are listed on a later slide, but linked to some of the things that we've touched on already this afternoon. Clearly, the landscape remains challenging for the NHS as a whole and for Wye Valley Trust as we moved into 25-26. We've set ourselves a break-even plan for the year. We still have a historic underlying deficit that we need to address over the medium term. But I'm really pleased to see the strong start that we've had in 25-26 in terms of financial performance. So a real testament to that culture of ownership, I think, within the Trust. Next slide, please. So this just sets out, as is in the annual report, a reminder of where our income comes from and where we spend our money. So no surprises in terms of expenditure, primarily on our workforce to deliver our services for our patients, and on those clinical supplies and drugs, etc., that allow us to provide that treatment alongside some of the costs of our facilities, our PFI estate, etc. And the majority of our funding comes from our Herefordshire and Worcestershire Integrated Care Board, but also a really significant element of funding from our Welsh Commissioners, and that's reflected, I think, in some of those activity numbers that Stephen included in the opening section. The next slide just reflects the capital spend in 24-25 in that range of projects. So our diagnostic centre, which is imminently going to open and be up and running, so a significant spend on that primarily, and then some of our other larger schemes and completing schemes like the surgical hub that Jenny alluded to in her overview. And so we're really pleased that we've been able to maintain that momentum of investment in our estate and some of those changes that support our operational delivery. And the next slide then is just an overview of the audit of the accounts. So our accounts have been through the external audit process, and our accounts and annual report have been signed off by our auditor as giving a true and fair view and being properly prepared. And what was really pleasing is we've been able to sustain the quality improvements in the audit delivery process that we've seen over the last couple of years. And indeed, our audit required fewer days than we'd first planned for with our external auditor. So I think that's a real testament to our teams and the auditor teams, and a real thank you to everybody that's involved in the production of the accounts. The auditors, as you would expect, flagged a couple of areas with some concerns around the value for money criteria that they're required to assess against. None of these were new and surprising to us. They're continuation of existing challenges that have been flagged to us before and we continue to work on. So our underlying deficit and therefore breach of our break-even duty, which continues to link into our medium-term planning. A weakness around underachievement of our cost improvement target. So although we delivered 14 million, it wasn't as much as we'd planned to deliver. And I'd hope that we'd see improvement in that in 25-26, given the strengthened start and the improved governance around it. And they also highlighted the oversight framework because we remain at a level 3 as a result of the financial override. So again, some strong performance in those metrics, but really about that medium term approach to stabilising our finances going forward. And I think that was all I had to say on the money, Chair.
Katie, thank you very much, and thank you again for your leadership on this. Just a few points I'd sort of add is for members of the public, we do have a challenge. It's a small, very rural district general hospital on our core economics, because obviously we have the full range of services and a relatively low population for the district general hospital. So it's why the work which Stephen and Chizu and others have been involved in on fragile services with Worcestershire Acute is so important. Katie, you quite rightly said about the numbers being the outputs of a series of inputs. Two people I'd like to shout out amongst the executive team. First of all, Lucy Flanagan, our chief nurse, for some really great work with Geoffrey Atuli on driving down our nurse agency costs, and now that's starting to feed across into our medical agencies as well. Lucy and Geoffrey, thank you for that. And on the capital side, a big shout out to Alan Dawson, because he's done some fantastic work, not just on the Community Diagnostics Centre, but also in terms of leading our sustainability work on the integrated energy scheme. So Alan, thank you and your team for everything you've been doing in that regard. So we'll move on then to the quality accounts, and Lucy, you'll be introducing these, and I think we're then going to move on and talk about some of the other exciting poster competition stuff that's been going on. So Lucy, and then Chizu, and over to you.
Thank you, Chair. As you say, I'm here to address the highlights from the quality account from 2024, which is an extensive document. It's published on our Trust website, and it looks back at the quality, safety and audit priorities that we set ourselves during 2024, and then provides some insight into the priorities for the forthcoming year. In terms of quality oversight and safety oversight arrangements, we have a quality committee that's chaired by a non-exec director, and that committee meets every month. The committee's ultimate objective is to seek to ensure that the services we deliver are of a standard that we would want for ourselves, our families, our friends, and ultimately the populations that we serve. And as part of that committee's duties, we continually seek to ask ourselves, are we safe? What are our priorities? What is new and different? And what are we especially proud of? Next slide, please. So in terms of safety, are we safe? Well, during 2024, we reported over 11,000 patient safety incidents. The vast majority of these were low, no harm or near misses, with less than 2% or just over 200 causing moderate harm. And they required a more detailed response to understand what went wrong and to ensure that we identified lessons learned and to improve our patient safety. During 2024, we fully embedded our patient safety response plan, which is part of that national patient safety strategy. And we know that those 11,000, those high levels of incident reports, evidence that we have a really strong patient safety culture where our clinical teams and wider teams feel confident to raise concerns and know that we'll take those seriously and embrace them to make sure that we make improvements to patient safety. We benchmark in the top quartile of all trusts in NHS England for our levels of incident reporting, and actually we rank the 6th highest out of 117 trusts for acute and non-specialist trusts for our incident reporting levels, which is really positive. We have a robust medical examiner service that looks at all community and hospital-based deaths, with over 1,000 medical examiner reviews that took place in 2024. 14% of those, or 154, required what's called a structured judgment review, which is a more in-depth review of those deaths to understand where care could have been improved. And additionally, we had 383 complaints, just over 320 claims, and 61 inquests. We use the intelligence from our incidents, our deaths, our complaints, and our inquests to ensure we continually review, triangulate, and identify the themes to make improvements and to keep our patients safe. Next slide, please. So we're not complacent. So what are our priorities for 2025? We continuously seek to improve our services, and for 2025 we agreed the following priorities. I'm not going to go through them all, I will touch on just a few. So VTE has actually been a priority for us now for a number of years, and that's with an aim to ensure that the risk of patients developing a blood clot are reduced by ensuring that we do a timely risk assessment of their risk of developing a blood clot and then prescribe the appropriate prophylactic medication. Until recently, the national performance measure was that 95% of patients should be risk assessed within 24 hours of admission, and during 2024 we averaged 91%. Our focus for this year and our priority for this year is to look at risk assessing those patients within 14 hours of admission and improving our performance to that 95% standard. You can see on there that we've got food quality as a quality priority. It's not just a quality priority, but it's a strategic priority for us for 2025, because our patients frequently tell us that our food service is not where it needs to be. And we've committed to work with Sodexo colleagues and other key stakeholders to improve the nutritional content, our food service and our menu choices for patients. And we also acknowledge that one size does not fit all, and that we need to find different options for differing patient groups and differing wards. A brand new focus for us for this year is diabetes safety. In the UK, it's estimated that 5.8 million people have diabetes, and it's estimated that over 1.8 million of those require insulin as part of their treatment. People with diabetes are at risk of developing other conditions, including nerve damage, eye problems, slow wound healing, and the risk of developing foot ulcers. So this year's priority will focus on foot assessment when patients are admitted to hospital, management of hypoglycemic episodes, the safe management of insulin, and that's really important. At our Safety in Sync meeting this morning, we discussed the complexity of insulin regimes and how it's important to understand that, educate our staff and educate patients if they're coming into hospital around maintaining their ownership of their own medical condition and the management of their condition when an inpatient in our hospital setting. We've got a priority this year for time-critical medications, building on the hugely successful campaign we had last year around Parkinson's medication. It's estimated that over 42% of hospital inpatients do not receive their Parkinson's medication on time, and last year's priority focused on that, and we were able over 12 months to achieve performance of 80% of patients receiving their medication on time, and in the last 3 months that was actually in excess of 90%. So given the huge success of that priority for last year, we've extended that priority to include epilepsy medication and insulin medication, linking to our diabetes safety priority. And finally, just to pick the last one from this slide from me, is around transition of care. And what we mean by this is for young people who have chronic medical conditions who are transitioning from care in our paediatric services into adult services. The evidence shows if you start to plan in advance and purposefully, then that transition will be more seamless. The evidence suggests that we should start planning as early as when young people are 11 and 12 years old, but no later than their 14th birthday. And so we've got a priority this year to make sure that we seamlessly enable our young people to transition from paediatric into adult services, to enable them to achieve independence in the management of their condition as they move into adulthood. Next slide, please. So what is new and different? Well, I could have filled this slide 10 times over. So actually what you see on this slide is some examples from what's new and different across all of our divisions. When we introduce new services or new pathways, what we're aiming to do is improve patient experience, value our patients' time, and ensure that we deliver best practice in everything that we do. You've heard many times today us talk about the Community Diagnostic Centre that's opening next week, and we're very excited about that. Again, I'm not going to go through all of these. I'm going to highlight just a few. But during 2024, we introduced the Orthopaedic Enhanced Recovery Programme, which was aligning our hip and knee elective surgical pathways to best practice. And you already heard Jenny allude earlier to how we've shaved the length of stay for patients by 1 day for both hip and knee pathways. We were an outlier nationally for the length of stay for patients on the hip and knee pathway. We're no longer a national outlier, but most importantly, we valued our patients' time by making sure that they spend less time in our hospital and are able to be at home and rehabilitate at home more quickly. In October 2024, we extended our critical care outreach service from 12 hours a day to 24 hours a day. The outreach service is made up of experienced critical care nurses and anaesthetic doctors. It's available to all of our wards, providing advice and management to some of our sickest patients. And since that service expanded to 24 hours, the service has received over 1,000 referrals and provided advice for hundreds of patients. We are in the second wave of piloting Martha's Rule, and our first step is piloting that patient wellness question for our patients, and having a 24-hour a day service, critical care outreach service, is essential for us to embed Martha's Rule into our everyday practice. Femoral fracture is a really serious injury. It's associated with high mortality rates. It's particularly painful and requires significant rehabilitation. Best practice to reduce risk factors associated with fracturing your femur include prompt assessment, optimal pain management, and prompt surgical intervention. Prior to implementing a test of change during June 2024, we know that many of our patients spent much more than 4 hours in our emergency department before being transferred into a surgical bed. We introduced a revised pathway in June, and since then 49 out of 77 patients, so that's 63% of our patients, now leave ED within 4 hours. They've been scanned, their fracture's been confirmed, their pain relief has been administered, and they've been listed for surgery, which is an excellent achievement and something we continue to focus on. And finally, from me, if I was to pick one more out from here, it would be the peripherally inserted central catheter service, or PICC line for short. So this is a service for our cancer patients who require long-term vascular access in order for us to deliver chemotherapy treatment to them. Previously, our patients had to travel to Cheltenham to have their lines inserted. And since we've introduced this service, we've inserted 600 lines, and we have only a 3% complication rate, which is way above the national average. But the main benefit is actually for our patients. We've saved them 2.5 hours of their own time in that they no longer have to travel to Cheltenham. We've saved them 76 miles of petrol money. And if you multiply that by 600, we've saved a lot of time for our patients, a lot of petrol money, and actually we've contributed to the environmental impact with less carbon emissions. So you can see there are lots and lots of new and different services and pathways that we've introduced during 2024. We continue to do so to make sure that our services are safe and effective and give the best patient experience. I'm now going to hand over on the next slide to Chizo Agwu, our Chief Medical Officer, who's going to go through what are we especially proud of. Thank you.
Thank you, Lucy. So the We Learn, We Share poster competition is an initiative to recognize and celebrate a culture of innovation, quality improvement, and learning. So we held our very first competition in 2024, where we had 26 really high quality entries. But this year, I'm proud to say that the number has increased significantly, that we had 76 really good entries. It's been truly inspiring to learn of all the amazing work from our various teams, which are aimed at improving outcomes and experiences. The slides, the posters that are shown on the slides are the second and third place winners for 2024. So it really gives me great pleasure to invite our very first winner of the 2024 poster entry, and that is Erin Chu, who is a lead rheumatology pharmacist, to share her work with us. Next slide, and over to Erin.
Thank you so much, Chizo. So as you've heard, I am the lead pharmacist for rheumatology. I'm clinically responsible for our biologics team, a team of administrators who really provided the legwork on this project. As winners of last year's poster competition, it has been a real honour for our work to be recognised. We've been so pleased to see this year's competition attract an even bigger range of submissions, as Chizo mentioned, and we hope to see that the competition continues to grow, celebrating the creativity and innovation happening in our teams at Wye Valley. I'm going to provide an overview of our project this evening, but I'm happy to be contacted outside of this meeting with comments, questions or feedback. Next slide, please. So our project relates to service provision around home care. For those not in the know, home care offers a dedicated pathway for the supply of high-cost drugs direct to patients. Benefits to the trust include VAT savings, and there are schemes offered funding delivery for many of our rheumatology drugs as well. However, there is still a significant administrative workload for clinical teams managing both the prescribing and queries associated with these treatments. Rheumatology here have the largest cohort of home care patients in the Trust, and we have curated a dedicated admin team to support the generation and renewal of home care prescriptions. Over time, though, there has been growth in terms of the number of drugs approved for us to prescribe, the range of indications each drug is approved to treat, and finally, we've seen an increase in patient numbers as patients are now able to access treatment earlier in the progression of some conditions. This is all great news for our patients, but rheumatology departments across the country are struggling to manage the increasing capacity required to deliver treatment to a growing number of patients. The tipping point for our service came in 2022, with staff turnover in key roles. The team lead for the biologics team left, and I joined the Trust as lead pharmacist 6 months after the previous pharmacist left. A further pharmacist vacancy due to secondment meant that there was no clinical oversight on the team, and very new staff were trying to find their way through. It turned out, the perfect storm. This ultimately led to overwhelm, with large numbers of prescriptions being due and overdue for renewal. As the situation emerged, contacts to the team increased exponentially. Emails from home care providers requesting prescriptions, phone calls from patients, as well as feedback from clinicians returning to clinic, identifying patients without or running out of medication. Delays with access to prescription meant that some patients experienced late doses. The smallest impact of this would have been worry or concern, but we know that some of our patients experienced symptom flare, which required further management to resolve. So this situation did result in harm. Working in this situation also had an adverse effect on staff well-being, with many finding it stressful speaking to so many anxious and distressed patients, either in our admin teams or in clinic as well. Next slide, please. So what did we do? The acute nature of this problem required a rapid and multifaceted approach, with solutions being implemented simultaneously. Rather than relying purely on our home care providers to request prescription renewal, we identified and triaged our workload, developing a work list with the help of pharmacy colleagues to help take control of our workload. We implemented an SOP to standardise decision-making and support newer staff to generate prescriptions. We worked towards extending our home care prescriptions. Previously, these had been limited to 12 or 16 weeks, but we've successfully transitioned towards 56-week prescriptions. This means prescriptions now require less frequent renewal, and there are less of them to renew. We recruited a pharmacy technician, Holly Crawford, to creatively backfill the pharmacist's secondment. As a side note, Holly was recently shortlisted for a national award with the Association of Pharmacy Technicians for work in this secondment, which is huge. I was also utilised in my capacity as a prescriber to reduce the turnaround for prescriptions to same day. Typically, this process could take anything up to 7 or even 14 days. So being able to respond quickly to this was essential. We also now aim to allow a 6-week turnaround for prescriptions. So we're renewing much further ahead than the home care companies were previously allowed, to try and minimise the pressure on any of this system. So next slide, please. What did we see happened? I've updated these figures since our poster submission of the summer of last year, but effectively you can see that we've halved the numbers of prescriptions processed by the team. In October 2023, we were looking at about 2,500 prescriptions per year, but in March earlier this year, we're estimating around 1,300 prescriptions per year. The numbers of overdue prescriptions have also fallen. It will be unlikely that we'll completely eliminate these, but we now know that these have been reviewed and we have assurance that all of these treatments are intentionally on hold. So we've gone from 33% down to 2.5%. And we sort of grumble along at about 25 overdue prescriptions where treatments are on hold. As you can see, that these improvements have been delivered despite patient numbers continuing to grow over the 18-month period quoted. We saw 20% more patients starting treatments in this time. Next slide, please. The poster competition was an incredible launch for us. We've gone on to represent Wye Valley regionally and nationally, sharing this work both within rheumatology and beyond, because home care pressures are just so relevant to so many teams across the board. The opportunity to present our project at this year's AGM could not be more timely. With the ongoing admin and clerical review, it would be remiss of me not to draw attention to one of the key conclusions of this work, that our admin teams are essential to the core running of our department. As a clinical team, we are proud to work with skilled and experienced administrators who enable us as we strive to deliver high quality care to our patients. In spite of continued growth in patient numbers, we have developed a sustainable model for service delivery within our existing staffing resource. With further growth anticipated in all areas across rheumatology, we are now keen to further upskill our admin teams and innovate further in order to ensure more patients can receive care we are proud of. Thank you for your time this evening.
Ellen, I mean, thank you. Your leadership on this has been wonderful, and the way the whole team has worked together. It's a fantastic example of the improvement work that goes across so many different aspects of what we do as a trust. And the thing I absolutely love about this is it's a solutions orientated mindset. And it's one of the things I'm a great encourager of, is that sort of engineering mindset. What's the problem? What are the different solutions, possible solutions? What's the best solution with the highest probability of success? So, Aaron, on behalf of the whole board, congratulations. Thank you very much. And please pass on our congratulations to all members of the team. Wonderful work. Thank you. So we're now at that stage where we are inviting any questions from members of the public. Gwenny, have we had any questions from members of the public?
We have. We've had one on email in advance, and the same question has been put on the live stream. Just waiting to see if any more come through. So I'll just read out that question that we've had, which is about the quality of food. There was an inpatient survey results came out last year which said our inpatient food is worse than expected, and they're asking for an update on what we've done about that. In particular, how has joint working with Sodexo, our catering company, enabled the trust to hold them to account, and what recent actions have been taken by the nutrition steering group and trust lead for nutrition? What impact has this had, and how has it been measured?
Lucy, do you want to answer that one?
Yeah, thank you. Thank you very much for the questions to members of the public. So when the patient survey results published last year, we pulled together a joint working group, including frontline colleagues, our Sodexo colleagues, to explore where we needed to make improvements. And that joint working has continued throughout 24 and into 25. And since that group's been established, we have introduced more choice. We've changed our menus in line with national requirements, but also looking at the nutritional value of our menu choice and offer. We now offer a wider range of snacks that are available outside of meal times. And we've introduced new crockery and cutlery, which we know has been received positively by our patients. We know we need to do more, and I alluded a little bit to that into the quality account presentation in terms of one size doesn't fit all, and we do need to look at the options available to paediatrics, for example, will be different to maternity, to surgery, to frailty. So more work to do in that space. It is worthy to note, however, that Sodexo don't provide our meal service in our community hospital sites, but we do use the same service provider to service our community hospitals and acute. And interestingly, our community hospital feedback results from surveys and other information shows a higher level of satisfaction with the food than it does for the county site. So therefore, some of our focus is what's called the last 10 yards, and the focus of which we think is around the food service and how it's delivered rather than the food that we deliver. So what the Nutrition Steering Group have done is develop some new routine audits, particularly around meal service and that last 10 yards, and also the provision of snacks outside of meals. Just so we can understand where we're not getting it right and target our efforts accordingly. The steering group has really enabled that integrated working, and all of our audits are now jointly undertaken with catering, Sodexo and clinical and dietetic colleagues. The steering group have also developed a new food and drink strategy, the current focus being on food as a medicine. And we've got an apprenticeship dietitian leading that with Sodexo colleagues. Given that strategy is brand new, some of what we will do is develop our audit programme in the context of that strategy as a way of measuring the outcomes from all of the work that we've been doing during 24 and going into 25. But more broadly, in terms of understanding whether the things we are doing are making a difference, is we look at various strands of information through family and friends, through patient feedback, through complaints, through our national surveys, through our patient-led place inspections, and from some of our monthly auditing. And we triangulate that information to check how we're doing, and then we use that information to inform our contract, our performance monitoring, and use that information in other relevant forums. We do know that the 2024 patient survey has just published, and we're due to discuss the results at our quality committee next month. But we know that many of the changes that we've made have been after that national patient survey was undertaken. So it may take some time for the national survey results to show, to demonstrate the improvements that we're aiming to achieve.
Thank you, Lucy. That was a very comprehensive answer. And Gwenny, have we had any other further questions come through?
No, nothing further has come through.
Okay, any members of the public on the call who would like to ask a question? Okay, I can't see any hands going raised up or anyone coming forward. So we'll move on then to celebrate and thank our staff, volunteers and partner organisations, and delighted at this stage to introduce Jane Ives, our Managing Director. Jane, over to you.
Thank you. Just the next slide, please. This is one of my favourite things to do every year, that opportunity just to set down and formally thank everybody. But it is my last formal duty as Managing Director of Wye Valley Trust, a post I've held for the last 9 years after an extremely long NHS career starting in 1980. But the last 9 years have absolutely been the highlight. But I've enjoyed every job actually I've done all the way through that time. So absolute pleasure to propose a vote of confidence to all of our brilliant staff, our One Herefordshire partners and our volunteers for all the work they do every day to care for our population, and actually all the staff who work in the background to support our clinicians. On the screen are the winners of the Going Extra Mile awards, and so we award those over the course of the year from nominations either from other staff or from patients. But they are absolutely the tip of a very enormous iceberg of people who go the extra mile every day. Visible in the NHS are, of course, the doctors, the nurses, radiology and diagnostics, school nurses, health visitors, theatre staff, therapists, etc., etc. But behind the scenes, there are many others. There's actually 350 different careers that you can take in the NHS. I always love that story about John F. Kennedy going to the Space Centre, and he spoke to the guy with a broom, saying, "What's your job here?" And he said, "Oh, I'm part of the team that's going to put a man on the moon." And so our digital teams, our finance teams, our information analysts, our pathology staff, admin and clerical estates teams, our educators, our researchers, our managers, there are so many people who are all part of this one big team to make sure that we give the best possible care to our patients and our communities. So I want to thank them all, and I'm sure I will have forgotten one or two the details and niche roles in that as well. But I thank you. I thank you all. I'd also like to make some very personal thank yous. So firstly to Glenn and to Russell. So thank you for appointing me to this role and for all of your support and wisdom over the years. I mean, my internal mantra of what would Glenn do, and then if I can't work it out, phone him as my phone a friend, has kept me on the straight and narrow and has really helped me to develop over the years. The foundation group has just been brilliant. That's helped all of us to have a much wider group of colleagues and their experiences to draw on, and they've helped us in Wye Valley to improve much more quickly, and equally we've helped the other members of the foundation group. There's always much more to do, particularly in our urgent and emergency care pathways, which are particularly difficult. But Lucy mentioned it quite a lot. The principles of valuing patients' time run right through the organisation. How do we make sure that we don't waste patients' time? Because if we don't waste patients' time, we don't waste staff time, and we don't waste public resources. So it's a really important principle. But we have come a really long way in the last 9 years, and that the set of presentations we've seen this evening have been a bit of a tour de force, really, haven't they? So thank you to the non-execs for all of your support, but I particularly want to thank my executive team colleagues. Honestly, their values, their skills, their work ethic are second to none, and I've been incredibly fortunate to work with all of you. As a team, we've made a difference, and that's what it's all about at the end of the day, isn't it? So thank you, everybody, and back to you, Russell.
No, Jane, thank you very much, and thank you for those kind words. There may be a few words in the other direction in just a few minutes, but first of all, I now want to pass on to the Chairman's Award, and this, as Jane was saying, is one of my favourite bits of the year, where we absolutely celebrate a team that has gone beyond the call of duty, so to speak, and Jenny earlier on was talking about the great work on the elective hub, and I'd therefore like to talk about the top team that put that together. Lynn Kedwood, Associated Chief Operating Officer on Performance Improvement, Kim Smith and Lydia Phillips, our Capital Projects Manager, who were nominated by a variety of colleagues for this year's Trust Chairman's Award for the work they did on ensuring that the elective hub opened on time, under budget, and operating as planned from day one. Anyone involved in capital projects of this scale will know how difficult one of those three would be, but to do all three was absolutely extraordinary. It's been hugely successful, as Jenny mentioned, for the Trust, with an 18% increase in elective activity, and the combination of Lynn, Kim and Lydia formed an extremely effective core team that oversaw the building, the fitting out and the operational opening of the building. Collectively, they formed a wonderful team and engaged brilliantly with all of the stakeholders, including our members of staff, our suppliers and our contractors, and in particular, thank you, Spell and Metcalf, who do a lot of work for us in the foundation group. And they made sure everyone worked well together and ran a highly effective project and surpassed, frankly, all of our expectations in the final delivery of the product. And I know from speaking to patients and clinical staff how pleased they are with the unit. The combination of Lynn, Kim and Lydia approached the scheme with the utmost professionalism, an enormous amount of positive energy, and frankly, a fantastic sense of humour. Everyone says what a pleasure they were to work with, despite the stresses of this important project, and they've just demonstrated how effective a core team can be on delivering complex projects of this kind and learning and applying it to other capital projects, as Katie mentioned earlier, a whole raft of which is coming on. So it therefore gives me enormous pleasure to present the Chairman's Award for 24-25 to Lydia Phillips, Kim Smith and Lynn Kedward. I know Lynn is unable to be with us tonight, but I invite Lydia and Kim to say a few words.
Can I just say thank you very much. It's lovely to be recognised because they are big projects, they're difficult, but I'm glad you mentioned everybody else, not just us, because it is a massive team. We're just the tip of the iceberg. You know, the clinical teams were wonderful. They had their day job. They still gave time to us to explain what they needed, why they needed it. If we had problems, they'd come and help us. You're right, Spellers are a wonderful organisation for us to work with. We're working with them on the CDC. They're exactly the same again. You're going to have another wonderful project delivered, you know, in just 2 days' time, which is brilliant. But yeah, people like, you know, Sodexo and that as well, they all worked with us, you know, from the cleaners to make sure that, you know, infection prevention can open your new services. It was wonderful to work with them all. And thank you for the recognition.
No, thank you, Kim. And Lydia, do you want to say anything?
Yeah, I just echo what Kim said. Thank you to everybody. It was for me personally, it was a huge surprise, but it's lovely to have the recognition. But as Kim said, it's all about the team. And it was lovely to have the enthusiasm as well and the engagement from everyone and the positive attitude to whatever challenges came our way. So I think collectively as a team, I think that's why it has been such a successful project to be part of, and we're all really proud of it. And hopefully, as people have been saying all evening, it's reaping the benefits now for the most important part, which are the patients. So yeah, thank you everyone.
No, thank you, Lydia. Thank you, Kim, and please pass our thanks on to Lynn. As we draw towards the close of the meeting, Jane said some lovely words about her experience working at Wye Valley for the last 9 years. But I just want to pass first of all to Glenn Burley, our Group Chief Executive, to say a few words, and then I'll maybe add a few of my own at the end. Glenn Burley, over to you.
Yeah, thank you, Chairman. As Jane has already said, this is the end of an era, quite a long era actually when you look at it, Jane. So well done. We've talked a lot this evening about great teamwork, but great teamwork needs great leadership. And for the last 9 years, Jane has been the managing director of Wye Valley Trust, and she's done a fantastic job in that role. But also 10 years prior to that, working for me elsewhere in the group, and 45 years in the NHS in total, starting as a nurse, but always a nurse. I think is probably the best way to describe Jane, always that patient at the heart of what she does. Jane has brought great energy, pace, innovation, never a dull moment when Jane is around. And I've thoroughly enjoyed working with Jane, and she's been a role model for lots of people actually across her career, but across the group. And as Jane quite rightly said, together as a group we've achieved a lot, and I know, speaking on behalf of board colleagues but also lots of staff across the organisation and our patients, we're really going to miss you, Jane. We will try our best to take your legacy forward, but you'll be a hard act to follow, so thank you very much for your years and years of service and your great leadership.
No, well said, Glenn. And just a few extra words from me. I've known Jane now for over 10 years. And Jane, I really don't think you fully appreciate what a role model you are for others and what an inspiration you are for others. And Glenn indicated you've been 45 years in the NHS. You started off as a nurse at the age of 18. And I can only imagine what the team felt on the day this Jack Russell Terrier, relentless, determined individual arrived to start their career. But you have been an absolute star. And, you know, I've always been a great believer that when you reach, and I used to say, and I'm now past it, at the age of 60, being able to look in the mirror and think, what impact have I had? That was always a bit of a driving force for me. What impact have I had? When you look back and think of the impact you've had, I think you can do so with immense pride. You have achieved a phenomenal amount and in extremely appropriate, professional, energetic way. And when I think back to what you've achieved just at Wye Valley, the opening of the acute medical unit, the same day emergency care unit, the demolition of the old hutted wards, the creation of a new Frailty ward block, the opening of the new surgical hub. We've got the CDC opening on Monday, and the turnaround of the performance from, to be honest, from when Glenn and I were asked to get involved at Wye Valley, where there was a real national concern about its performance, to where it is now. Jane, you've been absolutely the centre of all of that. You're much loved by your colleagues. You'll be missed more than you ever know. And you go with all of our love and best wishes for the future. Ladies and gentlemen, we've been blessed to have Jane Ives as our Managing Director for the last 9 years, and she goes with a round of applause from us all. So I think that brings us to the end of tonight's annual general meeting. Thank you very much for everyone's hard work and efforts throughout the year. Jane gave a fantastic overview of the enormous amount of teamwork at all levels within the organisation. I just want to add my thanks to the executive directors for the work they do day in, day out, and to their families, because I'm very conscious of the fact that being an executive director in an NHS acute trust is a very stressful job, and you take that home. I know you do. And you've got families and loved ones who share those burdens. And I know that's true for all of my clinical and nursing and support staff as well. So thank you, and thank you to your families. And to my non-executive directors who always try and provide wisdom and a friendly perspective on the challenges that the board and the executives are facing. Thank you for your considerable efforts on behalf of the citizens of Herefordshire. I look forward to seeing you next year, and in the meantime, I draw the meeting to a close. Thank you all very, very much. Bye-bye.